physician who is the author of Superbugs, the Race. Let's talk to Dr. Scott Gottlieb, former FDA commissioner and CNBC contributor. He serves on both Pfizer's and Illumina's boards. And Dr. Matt McCarthy, an infectious disease physician who is the author of Superbugs, the Race to Stop an Epidemic. Thank you both for joining us. Just to start off on a little bit different tangent, gentlemen. When did we discover penicillin? It was like in the 30s or so, wasn't it? I mean, what we've done in the past 90 years in the whole history of human existence, it's amazing where we are right now.
Discovered in 1927, became commercially available in 1944. We've had a long and successful history of diagnostics and therapeutics.
And we're better and better. Now we can sequence this thing instantaneously almost. We can do it in an automated way. Why shouldn't we be hopeful that we can come up with a therapeutic quickly?
Let me tell you the problem right now. Before I came here this morning, I was in the emergency room seeing patients. I still do not have a rapid diagnostic test available to me.
Well, that's easy to do, is it not? Is it hard to manufacture?
It is easy to do for some countries. What happened in the United States is that the CDC created a test,
messed up a reagent,
sent a test out to 50 states, and then said, oh, hold up, don't use it, let us fix it.
How quickly
it's
can
now
we get
March.
On track now, Matt?
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case, plead to test people. This is not good. We know that there are 88 cases in the United States. There are going to be hundreds by middle of the week. There's going to be thousands by next week.
So
and this is a testing issue.
What do you do with people in the emergency room if you can't test them?
Well, we call and we try to test. We isolate them. We have an outstanding team of infection control practitioners who know how to handle this, but they're hamstrung by the fact that we don't have a diagnostic test available.
Are people getting sent home? Because I read reports of that over the weekend.
We're not sending people home. We're making sure they get what supportive care we can give. But keep in mind, we now have this in New York State, right? The person who tested positive was only the 32nd test we've done in this state. That is a national scandal. They're testing 10,000 a day in some countries, and we can't get this off the ground. I'm a practitioner on the firing line, and I don't have the tools to properly care for patients today.
Yeah, the challenge is that the providers can't take proper precautions if they can't test and diagnose.
You've been talking about this for weeks.
Yeah.
This is what we need to do.
On the, on the therapeutic, I think this meeting today is focused on vaccines. We need to have a vaccine strategy. I think a vaccine is a year or two away. Right. I think we need to think about what we're going to have in the fall to be a backstop to this. Hopefully this will start to dissipate in July and August, but it's going to probably come back in the fall. And then what next? And the only thing that could be available in the near term is a therapeutic. If we have an antibody-based prophylaxis or a drug, because a vaccine's much longer.
Why isn't something existing in the HIV regimen that might work on a...
Well, we have an HIV drug, Kaletra, that we're studying right now. It's in a clinical trial. That information is not going to be available for a while. The message today is that we are hearing from this administration that the risk is low and that things are probably going to be okay. You don't need to change your lifestyle. That's simply not true. There are going to be thousands of cases here. We have already moved from containment to mitigation. We are trying to lessen the severity here. You are going to see widespread disruption to daily life. Do not believe the false reassurance.
So what does that mean in terms of what people should do on a daily basis?
Well, look, I think we're going to have outbreaks here in the U.S. There's no question about that. I think in parts of the country, we're past the point where we can contain this. We're going to have to look towards mitigation. Washington State, California. It doesn't need to become epidemic here in the United States. We have a much more advanced healthcare system. We have better infection control procedures in hospitals. I think we have the capacity to do that. I agree. We need to start taking more aggressive steps right now to make sure that this doesn't become epidemic. So we don't look like Wuhan.
China had testing. How did China to possibly be on the downside of the epidemic? How did they do that?
Well, and there's also something called the boomerang effect, which we may be seeing in Hubei right now, which is that places we think are clear are starting to have rates creep up. We may see things bounce back. But the key here is do not believe the false reassurance. I'm telling you, the cases are about to surge, and only then can we make informed decisions.
Doesn't that lower the denominator on the mortality?
Absolutely. So if we're talking about mortality rate, I see numbers like 1% to 2% thrown around. I don't believe that. The modeling we're using data out of Korea. We think that's the best
And what is that?
0.2, 0.4%.
So that's twice as bad as a seasonal
flu?
Correct.
So a very bad flu season. Keep in mind, flu kills 25 to 69,000 Americans. So a very bad flu season.
The panic that has been caused already and the economic effects, already much more than twice the mortality rate of the flu. We're at 10 times the mortality
Well,
rate of the flu.
what do you make of the Diamond Princess? Because I know that's not a typical population, but the case fatality rate there is going to be above 1% probably when that settles
Absolutely.
down.
And, you know, if you're an 80
Is that because it's an older population?
So, right. So if you're an 80-year-old on a cruise ship, you're in trouble. I mean, the case fatality rate's over 10%. We're seeing for ages 1 to 9 exceedingly low.
Right.
There's a lot about this we don't know.
Asymptomatic almost.
Absolutely. So widespread surveillance is going to start giving us information so that we can make these informed decisions about whether March Madness needs to be canceled.
Are there different levels of panic around the country? And the reason I'm asking is because I was in Detroit last week, and this is a small example, but I asked a room full of clients and investors, are you worried about coronavirus? And they unanimously said no. And I said, are you not worried because you think you're going to catch it and you'll still be okay? Or are you not worried because you don't think you're going to catch it? And they said, we're not going to catch it.
Yeah, I think this is going to, for a while, this is going to be regional. You're going to have regional outbreaks where you're going to have more focus on it in certain parts of the country. Washington State, we're probably a couple of weeks away from some significant measures in Washington State to try to mitigate spread, and Northern California as well.
Look, a couple of weeks away, it's got an incubation period of potentially a couple of weeks. So are we kind of just always going to be behind the 8 ball on this? We're reacting to the news 2 weeks later?
Well, we have a lot of undiagnosed cases to his point right now. There's probably, you know, low thousands of cases in this country that we now need to turn over the card on. So we're gonna have a surge in cases before we start to catch up to the actual level of spread. You know, it's a big country, 330 million people. So even if you have several thousand cases, your risk of contracting it's still low, but that could change very quickly.
Japan has taken some pretty extreme measures, like closing schools. Is that?
They're not diagnosing their cases there as aggressively as South Korea is or Italy.
That's right. We're going to see school closures here, definitely. You know, we're hearing that life's going to go about just like normal. That's not true. And to speak to the earlier question, I'll tell you, I live in Westchester. When I'm walking around Westchester, I'm not really worried about coronavirus. But when I get on the 6 train, when I'm walking around Times Square, when I'm in the emergency room every single day caring for patients, I am very worried. So
great. Thanks for joining us today, man. Santoli, you've got...
Yes.
Yeah.
Just because I ride the subway?
No, because you're sitting next to Matt.
Not as close as Scott is.
Yeah, not as close as
Yeah, I was going to give my... Santoli, here's my Purology.
Take it.
How many cases do you suspect you've seen? If you had enough cases, if enough testing, how many cases would you have tested?
Well, we've seen one case in New York. I bet there are hundreds. I bet there are thousands in the United States. And the longer we wait to get testing up and running, the worse this is going to be. But I'm telling you, as a practicing clinician, we're not there to
Why did I
begin
say
testing.
I thought they were shipping tests to California in bulk? I thought that was the latest.
The testing capacity by the end of this week, so we have about 100 public health labs. They'll have a capacity to do 100 tests a day. So it's at 10,000 tests a day by the end of this week. That still requires physicians like you to call the public health department in the state to order the test. So that's cumbersome. By the end of the week after that, we should have maybe as much as another 10,000 test capacity a day. So we'll be at 20,000 tests that we can run per day as we bring on the academic labs. That's going to make it a lot easier for physicians like our guest to order tests within their hospital.
Well, the
that's not
turned
available
up on
yet.
what you want, Matt, right?
Right,
I mean,
so that's right. So a week or two from now is when we're going to begin getting real information. Right now, we're still largely flying blind. So if you're worried about fear and uncertainty, we're still in the thick of things.